opportunity. We are offering this as a series. We also have other information and a Q&A section on the cysticfibrosis.ca website for your use that we're continuously updating on pretty much a daily basis as information changes or comes in. And also we have an information and referral service that's available to you at any time. You can email advocacy@cysticfibrosis.ca. That's advocacy@cysticfibrosis.ca, or call our office and someone will respond to you as soon as possible. All our offices are closed, but the phones are being monitored regularly, and we will return messages as quickly as possible for people who have questions or are looking for further information. So having said that, gone through a few housekeeping items, it's now my pleasure to welcome and introduce our experts for this question and answer session. As all of you know, we are fortunate to work with an outstanding team of clinicians from across the country, and we're really grateful to have two of them with us today who are sharing their expertise and some of their time during this very busy time for all clinicians. So it's my pleasure to welcome Dr. Valerie Waters from SickKids Hospital and Dr. Ann Stevenson from St. Michael's Hospital, who will be our experts for today's session. And I'll just ask Val and Ann if you could take a moment to introduce yourselves.
Sure. My name is Dr. Waters. I'm an infectious disease physician at the Hospital for Sick Children in Toronto.
And I'm Dr. Ann Stevenson, and I'm an adult physician at St. Michael's Hospital within the CF program.
Okay, thank you both. So we'll launch right into some questions. A lot of the questions we've received have centered around clinical care and how clinics are managing this situation with COVID-19. So perhaps you could comment on how you as clinicians and how your clinics are changing and adapting to the situation in terms of providing care for people with CF.
So maybe I'll start, Val.
Yeah.
So within the adult program, obviously we are modifying sort of typical clinics. We are not holding sort of our usual clinics, but instead we're contacting patients ahead of their scheduled clinic time. And we're seeing whether or not they are unwell or whether they're stable and it's sort of a routine visit. If it's a routine visit, then we're scheduling them as a telephone or a video conferencing interaction with the physician. And that's happening as well as seeing people in the outpatient clinic is still open for people who are unwell. So they are coming to the clinic and they're being assessed in the clinic rooms. We're not actually necessarily doing sort of the typical procedures that we normally would. We're sort of restricting some of the more high-risk procedures like spirometry or lung function. But in patients who need it in order to make a clinical decision, these things are being done. And we are still admitting patients to the hospital if they need to have IV antibiotics. And that process is also slightly different than what it usually is. We really try to bypass going through the emergency room, and we arrange for patients to come directly to the ward. And in addition, the patients might see that we're wearing different protective gear. So normally with CF, of course, we wear gowns and gloves when we see our patients, but during this time, we will be wearing a bit more, so mask and potentially a shield to just protect any secretions when we see the patients. So that's sort of the main difference, is that teleconferences for people who are relatively stable and a limited number of patients who are seen in the outpatient clinic setting.
And at SickKids, it's very similar to what Dr. Stevenson's describing. So all the clinics at SickKids have been asked to look at their patient population and their visits. And for those that can be switched to virtual clinics, those are being done for stable patients, either by telephone, OTN, guest link, different modalities, FaceTime, WhatsApp. For patients who need to be seen, they are being seen in clinic, and for admissions that need to happen, they are also happening. And like at St. Michael's Hospital, SickKids is also wearing masks for healthcare workers who are on the clinical wards and on the clinical services. So it's very similar to what St. Mike's is doing, SickKids is doing as well.
I should also add one other thing. A slight difference is just how you enter the hospital. So if for patients who actually do have to come to clinic, There is one entry point that they can come in through the hospital, which is the Queen Street entrance. And there are people there that will be asking specific questions about respiratory symptoms. And of course, our patients often, especially if they're coming to clinic, often have that increased respiratory symptoms with either increased cough or sputum. But they say that they're coming to the CF clinic and they're given a mask to go up to the CF clinic. And also we provide the people down there a list of the patients who we are expecting that are coming to the clinic.
Thank you both. So if beyond those protocols, if someone actually does have to be admitted to hospital during the pandemic, what are some of the things that might be different, or any issues that people should keep in mind if they do need to be admitted at some point during this time?
So at Sick Kids, we are under less bed pressure, I would say, than the adult hospitals. So for Sick Kids, the patients would still come to the floor. As Anne says, Dr. Stevenson says, the healthcare workers will be wearing masks, so that will be different, something that they will note. The entrances are manned with people who are screening, exactly as Dr. Stevenson said. And there is a limitation in terms of the number of healthcare workers that are on any floor that enter any room, and also in terms of the number of visitors and parents that are allowed to come and stay with their children in hospital. So Dr. Stephen can mention whether that, I imagine that is also true at St. Michael's Hospital, but we are trying to limit the number of family members and patients who are actually in the hospital on the floors at that time.
Mm-hmm. Yeah, and it's a similar situation at St. Mike's. There is a very limited number of visitors. In fact, there's a very small list of acceptable reasons for people to have visitors. Otherwise, visitors are not allowed to come to the hospital right now. And at St. Mike's, the other difference is that any patient who is being admitted, because they do have a change in their respiratory symptoms, they are being swabbed for COVID-19 prior to coming into the hospital. So in the clinic, we've been doing that and sending the swab off. It has been coming back in a faster turnaround time so that we get the results from those swabs quickly. And the patient, once the swab is negative and it's confirmed to be negative, the patient is then admitted to the respiratory ward.
And so at Sick Kids, the testing is done based on symptoms and the patient, whether they're immunocompromised or not. So CF patients who come in with cough would qualify and would get an NP swab for COVID testing. They don't have to necessarily wait for that test result before they're admitted, and that's just a little bit of the differences between Sick Kids and St. Mike's. But our test results have been coming out relatively quickly as well for our inpatients. So they would get an NP swab to look for COVID as well. They're still being admitted to 7C, to our usual floor, but this is because of the differences between adult and children's hospitals.
Yeah, and they don't wait in the clinic for the result to come back. They do get admitted to the hospital. They just don't go to the respiratory ward until we've confirmed that the COVID test is negative, because the respiratory ward is considered a high-risk ward, obviously, for patients with lung disease. And so there would be no COVID-positive patients that would be admitted to that area.
See one question that just came in that was related, sort of building off when you were talking about swabbing for COVID-19. Are there other viruses that are being routinely tested for as well? And are you seeing any increases in terms of anything else during the COVID-19 pandemic?
So maybe I'll start with that one. And so at Sick Kids, the nasal swab that's being done for COVID, our COVID testing is on our usual respiratory panel. So our respiratory panel at Sick Kids will include influenza, rhinovirus, coronavirus, a whole bunch of different viruses, plus the COVID. And that's specific to the testing that we do here with our kits. So when we send an NP swab, we get COVID plus the other viruses. We haven't seen an increase in the number of other viruses. We do usually have background influenza and rhinoentero at this time of year, and we do have patients who have other viruses that are isolated, but we're not seeing a particular increase in other viruses like influenza or parainfluenza, for example.
And in the adult world here, we do look for influenza and RSV. So those two viruses are also tested for when we do an NP swab for COVID-19, and they're reported as well. Not all of the other viruses that are typically done at sick kids are checked here in the adult population.
Mm-hmm.
Great, thank you. And for those that have just joined us over the last few minutes, welcome. I'm Jeff Beach with Cystic Fibrosis Canada. We have Dr. Waters and Dr. Stevenson from Sick Kids and St. Michael's Hospital, respectively, who are our expert panelists today. We've received a number of questions over the last couple of days through social media and email and other modalities, and some people are submitting questions now through the chat feature in Zoom. Please feel free to do so. We'll try our best to get through as many questions as we have today. And just a reminder for everyone, we are going to be hosting these Ask the Expert sessions over the next 3 Wednesdays after this one into the month of April. For those that might be joining us whose first language is French, we are working on a French Q&A session, Ask the Expert panel similar to this one, and we'll have the details out on that as soon as we can. Another question related to testing, I guess, would be because the symptoms of COVID-19 can be very similar to some of the typical symptoms that someone with CF may experience on a daily basis or during a particular exacerbation. What would be the main factors that people should be looking for if they're at home and they're experiencing some symptoms? When should they really be triggered to follow up with their care team on those symptoms?
And you want to start with that, or?
Yeah, it's a tough one because basically the symptoms are very similar to what a person might experience with a pulmonary exacerbation. Increase in cough, increase in sputum, fever may be present. That might be something that is not as commonly seen in the adults side. I'm not sure about pediatrics, but the symptoms are very similar. So it is extremely difficult to tell. Viral infections tend to have some other symptoms like headache, muscle pain, extreme fatigue, those sorts of things, which may be a bit more common with a viral infection versus a worsening bacterial exacerbation that people are having. But it can be very challenging to tell the difference.
Yeah, I agree with Dr. Stevenson. I think it would be very difficult. And so I think the trigger for CF patients in terms of calling should be any change as before that they would be worried about with increased cough and fever and change in clinical status that you would otherwise have called. I think that you should still use that as the trigger for calling. And the nurses and the physicians who are responding to these emails and phone calls can help in terms of trying to figure out, you know, is this a clinic visit or is this something, you know, we potentially treat with some antibiotics and follow up on. But I would say that the clinical status should trigger the phone call, as it always should.
Yes, and obviously this whole situation is unfolding as we speak. But are you aware of any sort of official information that would say that people with CF are a particular high risk for COVID-19? Is that something that has been officially declared? It seems like there's some conflicting opinions and information out there,
right.
But a lot of patients are wondering if that really is scientifically proven at this point.
Sure. So I guess I can start with that one, Anne. So when we think of patients who are particularly at high risk of infections in general, we include patients who have compromised immune systems, such as with leukemia, lymphomas, transplant patients, patients with chronic lung disease are more at risk of viral infections and respiratory infections. And so when this outbreak and pandemic started, it was thought that these would be the patients that would be most at risk of having more severe disease with COVID, or the SARS-CoV virus that causes COVID. And many recommendations have been suggested or put in place with that list of vulnerable patients in mind. The publications that have come out of China and some of the New England papers haven't specifically identified cystic fibrosis as a risk factor for severe disease. And anecdotally, when I have contacted my colleagues in places such as Seattle, New York, France, Italy, Ireland, the UK, I have not received any indication that patients with CF are getting more severe disease or becoming very sick with COVID. That being said, I think CF patients are quite astute and adept at protecting themselves against infections. So I think that they are quite good in terms of a patient population at high-end hygiene, trying to protect themselves, minimizing large, group gatherings. And so it's possible that we're not seeing it in CF patients because they are very good at protecting themselves against infections. So although we haven't heard of any patients with CF becoming very sick, I don't think that we can say that that's not going to happen. I think that that potentially could, but anecdotally, I have not heard from any colleagues or contacts in any of these places with very high rates of COVID that patients with CF are getting very sick and admitted to hospital.
Yeah, and I would agree, same in terms of speaking to colleagues around the world in adult CF centers. There has not been a huge number of CF patients who have been infected. I think too that there's important to make the distinction between, are CF patients more susceptible to COVID-19 is one question, versus if they get COVID-19, will they have a more severe course? And those are two slightly different questions. And I think that we don't know, and obviously what people are learning about this disease is evolving, but there's no evidence to suggest that CF patients would be more susceptible to getting this infection as other people. But as Dr. Waters said, if they got infected, it sort of stands to reason based on the fact that people with underlying illnesses seem to be at higher risk for having a more severe course, that you can imagine people with CF with underlying lung disease and potentially with other comorbidities or complications from their CF, like diabetes and other things, may have a more severe course. But we haven't seen that yet, and it's still really not proven.
I think, Jeff, the CDC came out with some data today showing that some of the risk factors for more severe disease included chronic lung disease, but within those only identified asthma, COPD, and emphysema. Doesn't mean that that's an exhaustive list. There could have been CF within that group as well. But again, as Dr. Stevenson said, not that is so far being reported or published.
And Dr. Stevenson, John Wallenberg here. Do you want to just update the people about how we are using the registry and international registries are tracking patients who are coming down with COVID?
Mm-hmm. Yeah, that's a good point. So as people probably are aware, there's the Canadian CF registry, and many countries have cystic fibrosis registries around the world. And there's an international effort actually that I've been involved with to try to track this information within the registries, both in the United States, in the UK, Europe, Australia, New Zealand, in order to try and get at the question of, is this really affecting the CF population? And if it is affecting them, what is the severity of illness? And that's been going on over the past little while, and we are tracking that within the registry across Canada. I'm not aware of any positive patients in Canada, but we hopefully will have that data kind of not in real time, but in a relatively short period of time, so that we'll be able to use that information in a timely way as opposed to waiting until the following year.
Thank you. Obviously, lots of questions coming in as well regarding isolation and quarantine and people trying to go about their daily lives and in terms of work and their families and so forth, and doing so under this heightened sense of awareness and concern. So I'm going to read a few questions that have come in along these lines. One is from a mom of a daughter with CF whose husband has had to go back to work. So they were in isolation with the exception of heading out to a grocery store weekly up to this week, but her husband has now had to return to work. They're very concerned about contact that he may have outside the home. So what they've done is they've set up where he is basically isolated to one room in the house. He's undressing when he gets home from work in the garage, leaving everything else at work. And her question is, are we going too far with this? Are we not doing enough? Should he look at maybe, because he's now working outside the home, should he perhaps live outside the home for a period of time? There are a lot of people with questions and concerns around how far they should be going in terms of isolation, particularly for those that are having to work outside the home.
Mm-hmm.
Right.
Well, do you want to start?
Yeah, sure. So I understand this is a terribly difficult question, and we have gotten a lot of questions from at the CF clinic as well from parents who are, for example, healthcare workers or who are nurses. So what do you do? I think that how much you do to protect your family or in terms of self-isolation is to a degree a person's acceptance of risk. I would say that the scenario that you described where the husband changes his clothes and presumably washes his hands, because the most important thing you can do to protect your family and yourself is hand hygiene, repetitive hand hygiene. So if he does that before he enters the home, I think that is excellent. I am hesitant about separating families and about having someone who is working live separate from a family, trying to protect those who are in self-isolation at home. Because the reality is that this may last for a period of time. I don't know how long, and I guess that's the million-dollar question. Everybody wants to know how long this will last. But to separate families like this, I think is very difficult and is not something that I would recommend. I would recommend to make sure that there's proper hand hygiene, changing the clothes. I've heard this before from other people, especially those who work in the healthcare setting. I think the predominant mechanism of transmission is droplet, right? So it's transmitting it from hands and onto a person, into their environment or into the home. So if this person is washing hands very well, coming home at the end of the day, I cannot say I would recommend separating and having somebody move out of the house. Of course, there are those who will want to do that, and that is a personal decision that I think I cannot fault anyone if that's what they want to do. If the husband gets sick, well, then that's a different story, I think. If someone has symptoms consistent with COVID, with fever and cough, I think then there would be a rationale for what I've heard some people trying to do is self-isolate within the home, either in a basement or in a separate sleeping arrangement, or, if they want to go live with another person that they know or another family member. I think that's a different story. But an asymptomatic husband who comes home and who does proper hand hygiene and adheres to these infection control recommendations that we have been doing, I think is appropriate and adequate in my opinion. And I don't know if you want to speak to it.
Yeah, I mean, I think I agree with everything that you've said, and it is difficult because you can go to such extremes to try and prevent any transmission. But I agree that if you're removing the clothes outside, you're doing good hand hygiene, you know, maybe you go directly in and have a shower, that should be enough, and would put the family, I think, at a very low risk of having any transmission, especially, as Dr. Waters said, if the person is asymptomatic and not having any symptoms of fever, cough, or shortness of breath, etc. I think you have to kind of balance what's reasonable and you know, what's safe. I'm not sure what profession or what job the person is in, but that's another thing that I would consider, because if they're at a job, they're going to work, but they're not at a job that is high risk, say a healthcare worker, or someone who's dealing directly with the public. If they're going to their office and they're working in their office for whatever reason, they can't do that from home. Again, that's another level of lower risk. So you'd have to take all of that into consideration.
I know one of the questions that we saw come in was from someone who's parent of a child with CF who works at a grocery store. In that sort of closed, but for those that are working in grocery store, for there's takeout, are they, would you consider them to be in a higher?
I think, Jeff, you're cutting a little bit in and out. I think you said that the parent worked at a grocery store, yeah. And obviously that's sort of dealing with the public, which could be at increased risk. Some of our patients, you know, our patients have asked us for letters, and sometimes not so much for the patient, but again for a partner who is in a high risk job that they could not work. And I think that that's completely reasonable. We have been providing patients with those types of letters. And the other thing is to consider, is there any opportunity at the workplace, if they do have to go in to do some other type of job within that occupation that wouldn't involve dealing with the public. So for example, if someone was a cashier or someone was directly dealing with the public in a grocery store, could they be redeployed to work sort of in the back room or stocking shelves? I mean, it's still a risk, but perhaps it's a slightly lower risk.
Thank you, and I do apologize if the internet connection goes in and out. I know that question may have been cut off, but you did cover quite well. Thank you. In terms of a lot of questions we're getting, speaking of groceries, are around food-related questions. And so two things in that area that I would ask you to comment on. One would be in terms of grocery shopping. You know, we've heard people taking various extreme measures in terms of wiping every single package down or not. Do you have any advice in terms of what people should be doing with packaged goods, but also fresh produce? Is that something that people need to be concerned about, or should they just be rinsing fresh vegetables and fruits like we normally would? And then the second part of that question is more to do with takeout. And if you have any comment or any advice for people who may be having food delivered or going through a drive-through.
Right. So, you know, in terms of the groceries, I've heard this as well. And I've heard this also when it comes to the elderly, for example, grandparents and whatnot, in terms of what do they do with the actual groceries. I think if a less susceptible person can go and do the grocery shopping, I think that is fair. Bringing the groceries home, I have heard of people who have wiped down the outside of all the packages. I honestly can't say whether that is necessary or is indicated. It certainly seems to me that would be as much as you would do for, you know, a particular package. I don't know what else you could do. In terms of the fruits and the vegetables, I think washing, just as we would previously do, is sufficient, and what you would do as well. This virus can live for some time on surfaces, but it does not live forever. And its conditions of living on surfaces is very much contingent on what kind of sample it's in. So if you're in a sputum with lots of potential nutrients that the virus can live on, it may survive for quite some time. But if you wash things, you will wash off the virus. And there are many kind of cleaning products. Do not recommend putting your fruits and vegetables in bleach or anything like this. I think just washing with regular water is all you want to do, because you do want to be safe as well with these cleaning products. I don't know, Anne, if Dr. Stevenson, if you want to comment anymore. And yeah. the takeout, similar thing, right? So honestly, many people are leaving them at the door now. It is a risk for the delivery people as well. They leave it at the door. If you bring it in, you wipe down the outside with the Clorox. That is as much as I think I would recommend.
Yeah, I agree. I mean, I think that in general, the risk of takeout or delivery of takeout food to your home is considered to be a low risk. And if some people, you know, like Dr. Waters said, they'll leave the food at the door, you can do electronic payments. And then imagine if you were worried about it and you took the food from the door to your home and basically took out the food and took the packaging away, put that in the garbage, wash your hands, and then, you know, handle the food. The key thing there, again, as we've said over and over again, is good hand hygiene and just doing that, which the CF patients are experts at. That's going to be your biggest way to reduce the risk. And for sure, the virus can live in sort of, they've done experiments where they've kind of done controlled experiments to see how long the virus can live. And it does vary depending on the surface. But when you're talking about, you know, the general amount of time that this virus lasts on surfaces, it's say up to 3 hours, but it can be longer if it's a different surface. But the other thing is just, I would say at home, it's a good practice to just regularly wash down your countertops or hard surfaces that potentially could have come in contact with any viruses, and then wash your hands and you're good.
Okay, thank you very much. I'm going to shift gears a little bit here. We've had a couple of questions come in from people who, one of them, for example, is someone that lives with cystic fibrosis, and his wife is pregnant and due at the end of May. They have been concerned about whether or not he should actually attend when his wife is going to give birth and be at the hospital. And also, once the baby is born and they've been discharged from hospital, should they self-isolate for 2 weeks after coming back from the hospital?
Yeah, I'll take this one. Dr. Stevenson and I did discuss this ahead of time. So I understand that the hospital and the healthcare environment is often seen as a potential reservoir for infections. And in general, that is always a possibility. In respect to COVID, the hospitals have done a lot of procedures and policies to minimize and to decrease the risk of any kind of nosocomial transmission or transmission in hospitals of COVID. So as Dr. Stevenson described, at all the doors now, there's aggressive screening for anybody who's symptomatic, doesn't enter a hospital unless they're patients. The floors, all the healthcare workers are wearing masks to prevent transmission with asymptomatic shedding. And so the hospitals should not be considered to be high risk for transmission of COVID to a patient. They have done an enormous amount of work to make sure that that does not occur. So if you do need to go to the hospital, and I would say that supporting a partner for a pregnancy is a good reason to go to a hospital, then you should feel comfortable that you can go and you can go so safely. I do not think that the patient with CF has to stay home and not go. They should call ahead to the hospital that they're delivering at to see what the policies are. Because, for example, Mount Sinai across the street will restrict to one visitor, and then there's no in and out privileges. So you want to make sure that you know that ahead of time, so you've packed all your stuff. You're not running short on diapers or anything, so that you have you're prepared for that. Similarly, when the mom and the baby come home, I would not recommend that they be self-isolated. That is not considered an exposure to be in a hospital with all the appropriate infection control that's being done to prevent transmission. And Mount Sinai is still having deliveries, and they're still obviously having partners come in as well. So I think, again, on the balancing of risks, I don't think that that should be a reason not to go into the hospital and support their partner, or to self-isolate the mom and the baby when they come back.
I think that is perfect, Dr. Waters. I agree completely. And in fact, you know, delivery is, and having a partner with you is one of the exceptions to actually allowing a visitor. As I said, that the visitors are being very strictly reduced in the hospital, but that is one of the ones where there's an exception that's made.
Excellent, thank you. There were a couple of questions that came in around concerns outdoors. For example, one person wrote in and said that they try to be active as much as possible, which is always good for people with CF, or for any of us for that matter. Are there any extra precautions that people should be taking when they go back home if they've been out, for example, for a run, for a walk, or anything like that? And when it comes to social distancing, if there's outdoor contact, like I've seen, for example, in the neighborhood, people standing across the driveway from each other, sort of sharing a drink, so to speak. Is there, you know, from that perspective, when we're outdoors, how far do we have to take this in terms of those type of precautions if they're not coming in contact with any surfaces or going into any buildings?
Right.
I mean, I think,
go ahead.
This is like, you know, the message that the government and the public health experts have been giving all along. And that is that going outside is fine, but it's the congregating that's the problem. So it's a social distancing that's not being adhered to. And that's one of the reasons why, you know, they're closing parks, and they're, you know, closing areas where people might tend to say, yes, I'm going outside, but then 20 people stand around together in a park, or a bunch of kids are playing in a playground. So I think that going outside is not a risk. Certainly going for a run, you know, going for a bike ride, getting some exercise, I think for all of us is really important, because it's hard to be inside all the time and not do any exercise, especially if you're used to doing that. So that's really important to do. I would continue to do that. And even walking by someone, you know, if you're 3 feet or 6 feet apart, you know, the risk is negligible. So there isn't a risk to somebody, because remember, this is a droplet type of contact infection. That means that if someone coughed or sneezed, which generally they would try to do in their arm, not sort of out in the open, but if they did, the droplets are heavy, they're big, and they drop down to the ground, and then somebody touching that area and then touching their face, that's the risk. If you're walking by someone, and especially if you're 6 feet apart, it's not the situation that you're going to inhale something and then get infected with COVID-19. So I would definitely recommend people do go out, but still maintain the social distancing, 6 feet apart at least. And even if you do go outside and you're talking to someone across the street, you know, that's acceptable too. You know, that we still have to have social interactions with people, but it's just not in close contact.
Yeah, and I would just add, as Dr. Stevenson, agree 100% with everything she said. And then when you come in the house, you wash your hands. So I tell this to my boys every single time they get home. They wash their hands. And if you have the hand sanitizer, if you're one of the lucky few who have it, carry it around in your purse or in your backpack. And if you happen to touch something, hand sanitizer, right? So everything that Dr. Stevenson said, and wash your hands.
That recurring theme for sure. And we just need to continually remind ourselves. I have 2 young kids myself, and that's, I want to record myself saying, wash your hands, wash your hands. But it really, you know, in all seriousness, it really does come down to that in many cases in terms of protecting ourselves. So thank you for that. Just to pause for a second, I want to thank Dr. Waters and Dr. Stevenson again for joining us today. For those that have come in on the call recently, We are starting a series of Ask the Expert Q&A sessions today, and we'll be doing them throughout the month of April every Wednesday at this time. And so I want to thank you for joining us, and please continue to submit questions. There is no way that we're going to get through all of them today. We've had quite a number of questions, even just coming in today through the chat window, which Devin has told me he's trying to keep a log of as questions are coming in. But please continue to submit them. We do have a great Q&A section on the cysticfibrosis.ca website that I would encourage you to check frequently, because we are updating it regularly. As part of that as well, Ian McIntosh, who's part of the I think you can see on the screen as one of the panelists, there's Ian, has been working really hard to be in touch with all of the CF clinics across the country, and has been populating information on our website in a section. If you click on the COVID-19 Q&A section, you'll see a clinic information section there. So there's a lot of information from each of the individual clinics, because Dr. Waters and Dr. Stevenson talked earlier in the session around the protocols that they're taking and what they're seeing in their clinics. Some of these obviously are standard procedures. Some might be different. Some clinics might be doing some things differently. So I would encourage all of you to make sure that you do check out the website, check it frequently, and look for information that might be specific to your clinic. I also want to mention that we are recording this session, and we will be posting all of these sessions and keeping them in an archive for people who weren't able to join us today, or if you want to go back and play it again and relive some of the information that we're presenting. So that will be available to you as well. We have had quite a few questions come in from people who are transplant patients, and they're wondering what this new reality might look like for them in terms of any extra concerns for people who are transplant patients.
Right. So like the CF patients, transplant patients would be considered vulnerable patients because they are on immunosuppressive medication, which is lowering their immune system. So by definition, they are more susceptible to infection in general. Again, from my anecdotal understanding from my colleagues is that I have not heard of any transplant patients who have gotten very sick with COVID, but it could be possible. And like with CF patients, you would want them to be very careful with infection control, hand hygiene, social distancing, and adhering to all this, because they would potentially be more at risk, although that has not been identified in the publication so far as a risk factor for severe disease. But they should be cautious, like our CF patients.
And also I would just add that there was some question, I think, amongst some patients that perhaps their immunosuppression, so those pills to suppress their immune system post-transplant, should be adjusted. Should patients reduce the dose of those medications to protect themselves from getting infections from COVID-19? And obviously that is something that is not recommended at all. And it should be done in conjunction with the post-transplant or the transplant program that the person is affiliated with. And certainly speaking to my colleagues here at the Toronto Transplant Program, they are adamant about not doing anything like that, because that could put you at high risk for actually rejecting the lungs that you have or the transplanted organ that you have, and is not necessary to prevent COVID-19. All of the other measures that are being recommended are the things that you need to focus on to protect yourself from that infection.
Yeah, fully agree with that. Yeah. Thank
you. A lot of questions coming in as well around modulators, and obviously the big focus for us, Cystic Fibrosis Canada, and the entire CF community, not just in Canada, but around the world, has been access to modulator medication that's available, produced, but not available here in Canada. And so questions have been coming in around I would say two main themes. One is, are we still advocating for modulators? And absolutely, yes. The entire community, Cystic Fibrosis Canada, and the entire community are focused as much as ever, on access to medication. Obviously, we've had to change our approaches. We had, for example, some provincial legislature sessions that were planned to do some advocacy work in different provinces, and we've had to change that because there are no public gatherings at this point in time. So we've shifted, but that doesn't mean that we're taking pressure off. And John, I know you've joined as part of the panel. I don't know if you have anything to add about the advocacy efforts that are continuing at this point.
So we are adjusting, as you said. Certainly for the previous couple of weeks, the attention of our governments has been preoccupied with certain with the COVID, but the activity in terms of advocating for the modulators is still ongoing. It's just we're a little bit less vocal about it right now, at least in the public facing right now. Nonetheless, there's activities, and as you're aware, we're actually going to be holding a webinar for the clinical community to further explain what the barriers are and to what they can actually do to help us advocate for increased access. And that's going to be happening both in French and English in the near future. So those activities are ongoing, and we understand the importance of these drugs, not just for today, but for the long-term future for everybody.
Yeah, absolutely. Thank you, John. And a question perhaps for Dr. Stevenson and Dr. Waters related to modulators. A lot of questions have been coming in around how effective they may be in terms of helping with this whole situation around COVID-19. So are people who are on modulators less susceptible to COVID-19, or would this be of benefit for people who are on modulators versus those who are not?
Yeah, I mean, I don't know physiologically if there's any reason to think that the drug itself, the modulator, would be helpful to fight COVID-19 specifically. But just thinking about the fact that if someone has underlying lung disease and there's anything that you can do to improve lung function, improve their or decrease their risk of having a pulmonary exacerbation and requiring hospitalization, because those things we know are associated with reduction in lung function. If there's anything that you can do to improve those things, then you would think that that would put someone at perhaps a lower risk of having a severe outcome should they get infected with COVID-19. I think that that's speculation. We don't know that for sure, but in theory, it sounds like it makes sense. But I don't think there's any evidence or reason to think that the drug itself would be protective or treat COVID-19 at all. I don't know if Val, you have any thoughts?
Yeah, no, I agree with that, Anne. I think like you just basically want to be as healthy as you can to try to avoid any comorbidities are associated with increased, more severe disease. So you can be healthier to start, then I think that's a good thing.
Mm-hmm.
Thank you. Some of the questions we've had that have come in, just to shift gears a bit as well, have been around the use of masks. And we were talking earlier before anyone else joined the session around the use of masks in general and seeing some people wearing different types of masks. Do you have any advice for people who are living with CF as to whether or not they should be using a mask in certain situations? And if so, are there certain types of masks that they should be considering?
Right. So the recommendations even before COVID were for CF patients who were entering healthcare institutions to wear a surgical mask while they were in the healthcare institution. And I think that that would stand. I think that that is still a current recommendation. When you're talking about wearing a mask out in the community, for example, going to the grocery store or going out and about for a walk, the public health authorities are not recommending that at this time. This may change, and as you know, during the COVID pandemic, things do change depending on changing situations. So the US may be moving towards that, although they have not made that official recommendation yet. And so at the moment, it's not recommended that the general public wear the masks out in the community. That being said, everyone has seen that lots of people are. The disadvantages of wearing masks is that it tends to encourage people to touch their faces, to readjust their mask. So depending on what type of mask you're wearing, there's a human tendency to touch and to fiddle with the straps and to touch your eyes or your nose. And if you have contaminated hands and you do that, you're more likely to infect yourself. If you never touch your face, then that's one thing, but it's human nature to touch your face. So that would be the downside of wearing the masks. If people do decide to wear the masks, the surgical masks with the straps or the ear loops would be what I would recommend. I would not recommend the N95 masks for the reasons that it is to protect for airborne infections. And as Dr. Stevenson said, the main mode of transmission is droplet contact for COVID. They're also extremely uncomfortable. Having worked in the TB clinic every week for 15 years, I can tell you they're very uncomfortable. So to wear them long term, I think is not very realistic and not required. I don't know, Dr. Stevenson, if you want to add anything to that.
The only other thing I would say is that sometimes I think if people are wearing a mask, they also can be lulled into a bit of a false sense of security, right? That they can come closer to somebody, closer than the 6 feet that's recommended. So I think that the touching of the face and that other sort of potential risk of not social distancing to the degree that you would if you weren't wearing a mask really kind of makes me think I wouldn't recommend it at this point. But as Dr. Waters said, I mean, things are changing every day. So it's hard to know. Just as an example, a week ago, we weren't wearing masks and in all areas of the hospital. We were only wearing masks if we were going in to see a patient and there was a reason to be doing it. But a few days ago, that completely changed. And now, obviously in my office, I'm not wearing a mask, but any other place in the hospital, in the hallways, anywhere where there could be contact with other people, I have my mask on. So it is an evolving sort of thing.
Thank you. We have about 5 minutes left in the session today. So I'm just going to remind everyone that this is the first in a series of Ask the Expert Q&A webinars that we'll be doing over the next, including today, 4 Wednesdays in April at this time. So we recognize that there are more questions coming in even in the moment now than we can possibly address today. We are recording these sessions. We will continually update the Q&A section on our cysticfibrosis.ca website with information as it becomes available. So please continue to submit the questions. We'll cover as many as we can over these sessions over the next few Wednesdays. And we will also continually update information that we're putting out through our website and on social media as well. So a couple of more questions that have come in advance before we close off. One, actually there were a couple of people that sent in questions around air filtration systems, and do you have any advice for people around whether a fixed or a portable system would be best, and if that's something that people should really look at focusing in now and investing in?
So again, because as Dr. Stevenson said, the main mode is contact droplet, and it's not an airborne infection, that I think that air filtration systems, while there's no harm in them, I don't think that that is going to get rid of the main mode of transmission for COVID. The virus is very small, and I think it's better time spent to, again, I'm repeating myself, wash hands and clean surfaces than to try to get it out of the air, because it doesn't travel very far, as Dr. Stevenson explained. So, 6 feet is actually not that far a distance. So that's what I would suggest. So Dr. Stevenson, you can chime in.
Yeah, and I again, watching CNN last night, there was a question along these lines that was posed to Dr. Fauci because there was some report that said it can travel 17 feet or 22 feet or something like that. And he clarified that that is, not sort of typical and would be sort of one of those chew moments where you don't do anything about doing it into your arm and you just do a huge sneeze, and maybe some people could have that travel really far, but generally that is not the case, and it's just within the sort of distance around your body. So, and if you sneeze into your arm, it's even less. So the bottom line is that it will drop to the ground. It's not aerosolized. And so having a filter for the purposes of COVID-19, I think is not necessary.
Thank you. Just one more question before we close off today. And I think this is a theme that we'll probably focus a little more on as we go forward over the next few weeks. But some questions are coming in around when we get through this and when restrictions are lifted around social distancing and these various protocols. Whether people with CF should continue to be really vigilant around social distancing, even beyond the time when the announcements start to come out around these restrictions being loosened or lifted eventually?
So, I mean, it's a good question. I don't think we know yet exactly how long this virus can potentially circulate within a population. So if you look at the China experience, for example, they very clearly had a huge wave that seemed to abate, but it's not clear whether there could be second or even third waves of the infection. So adherence to hand hygiene and good infection control is always in the best interest of CF patients. How long this social distancing will occur and whether it may need to be reinstituted with second or third waves, I cannot answer that, and I don't think anybody can. I don't think we know enough about how widespread the immunity may be and how long lasting the immunity may be, and to what degree you need herd immunity to prevent future outbreaks in the future. So I don't know that we know the answer to that.
Mm-hmm. And maybe once we have a test to check for antibodies to see if people have been infected and maybe were asymptomatic, you know, that might be something that helps sort of ease people's minds to know that they have these antibodies and they'd had the infection already, so that these measures, these extreme measures, might not be as necessary for someone like that. But I think the future is really up in the air, and it's difficult to know how it's going to happen, you know, in 3 months, 6 months, 12 months. We'll have to just wait and see.
That's fair. Thank you. Well, it is 1 o'clock now, and so we are going to end the session at this point for today. First of all, I'd like to take an opportunity right now to thank you, Dr. Stevenson and Dr. Waters, for joining us and sharing your expertise and your time. I see Ian applauding. I'm sure others are out there as well, and we can't thank you enough. We know how busy you are and how the demands are on your time right now. So we really appreciate you making time for us and for the entire cystic fibrosis community here in Canada. So thank you both. And wanted to also remind everyone that this is a series. We are going to be holding similar Ask the Expert sessions on April 8th, 15th, and 22nd. Reiterating as well that we are working on a French language Q&A session as well, and we expect to have something out around that very soon. And want to encourage people to continue to submit questions. We didn't get to all of them today. I knew we wouldn't, but we did cover quite a bit of ground, and I thank you again for everyone for submitting questions. There were some really good questions that came in. For those that we didn't get to, we are keeping a log of them, and we're going to address them in future sessions like this, and we'll continually update the information that we have going out through social media and on our website, cysticfibrosis.ca as well. Final reminder, if you have any specific questions, concerns that you want to speak with someone about directly, you can always call our office or email advocacy@cysticfibrosis.ca, and someone will get back to you as soon as possible. If we don't have the information you're looking for, we'll do our very best to connect that for you. So again, thank you to our expert panelists today. We really appreciate it, and thanks to all for joining us. Have a great day.
Thanks so much.
Thanks, Jeff. Thank you.